So now we're talking partials today, aren't we?
We are. We've had a few patients come in recently and sort of have just lost one tooth, and some have lost several teeth, and we've recommended having a little partial denture. Or how do we fill the gap?
Yeah.
So, naturally enough, there's several ways and several reasons as well. So maybe if it's a front tooth, it's aesthetics, because people don't want to walk around with a gap. And so how do we fill that gap? And there's implants is your best option, and we create a little cavity in your jaw and put a dental implant. It's like a knee or hip replacement, and then
it's a good way of describing it, actually. Yeah.
And then put a crown on top, and that's permanent. So it's just filling that one gap. So that's the most expensive, but it is the best. It's called a fixed option.
And how long will that implant last for?
That's a good question. We tend to use recognised implant systems like Brannemark, Straumann, 3i. They're all science-based. So that's how long have they been in somebody's mouth.
Right.
So we're looking at 40-odd years. So every year it goes 41,
great.
42. But we know with a degree of certainty that it's a lifetime. But there again, you have to look after the implants, because you can end up with periodontitis, which is a gum disease, and you can also end up with implantitis as well. So you've got to treat it as your own natural teeth and brush it and look after it. And
so don't forget about it.
Yeah, that's right. And have your checkups once a year as well to just make sure everything's okay. And then we can sort of, another fixed option is a bridge. And what we do then is cut down two adjacent teeth, make up a little framework, and build up a porcelain substructure or structure that fits over that, and that's cemented into across that gap as well.
So it really is like a bridge over the three teeth, including the one in the middle that's come out.
And they're permanent options. And then we get into what we call removable options, the removable partial dentures,
Right.
RPDs we call them. And which there's a variety. And again, that can be aesthetically driven, but from a clinical perspective, why do we say to your patients, or say to you, if you've lost a tooth, why do we want to fill that gap? And it's just maintain the space, because teeth are in a dynamic state. You think they're anchored in bone and jaw, and they're quite rigid and don't move, but they're actually in a dynamic state. They actually move ever so slightly every day. And over a period of time, if you've got a gap, the teeth can drift and fill those gaps. They can tilt sideways, they over erupt.
So they can still move, even though there's a gap there, they'll still move
absolutely, around. Though, especially if you're brushing your teeth looked up, and some people have got some a crowded situation, your teeth are all twisted because there's not enough room. Suddenly, if you lose a tooth, over a period of time, it won't happen overnight, but over a period of time, the force of the teeth might say, "Oh, I've got a bit more room now."
Yeah, you've got to stretch out.
Yeah, stretch out and relax and move around. If you lose 2 or 3 teeth, teeth are designed by nature to grind your food and incise your food. So they're designed to oppose a tooth. So if you haven't got an opposing tooth, what we say is a tooth can over erupt. So it's actually looking for another tooth, an antagonist, to come in and grind that food to contact. So again, for clinically, why we say you probably need to look at a partial is to stop this over eruption and stop this drifting. I've got a couple of little diagrams here that can explain that. Well, hopefully it can explain that. So here, the top one, if I hold it, so it's the top one here is a full dentition, and in this one here, it's stylised that this patient's lost several teeth on the lower jaw. So what we recommend is having a partial to restore the original dentition.
And so it just sits in the gum there and looks as new.
And you take it out, it's removable, so you take it out to clean it every day. And what can happen if we don't is, you can see this tooth here, it's just slightly tilted, it's drifted, as opposed to if we just shoot up to here, this one is more upright. And then this opposing tooth has no antagonist now, so it's actually over erupting.
Yeah, so it's moved down, isn't it?
It's moved down, and again, I've had some patients in recently that we've tried to, they've said now, I would like to have a lower partial, but aesthetically the occlusal table is dropped down, so it poses questions of what do we do to try and balance all that up.
Yeah.
Now there is another reason why we like to have partial dentures, especially in the lower. If somebody has lost a lot of, or most of their posterior teeth, their grinding teeth, we have what's called a combination syndrome. So all you're forced now, this person's trying to bite, chew, and grind their teeth with their lower anterior teeth. And the lower anterior teeth are what we call incisors teeth, so they're there just incise the food, and your back teeth, your molars, are your grinders. They just grind it, pulverise the food and do the hard work. But now with just your lower anterior teeth, they are trying to do everything that nature designed for them to do, and they're smaller, so they aren't really designed to do that. What can happen if you've got an upper denture is you end up with this fulcrum and tilting.
Okay.
And so what we try and do then is put a lower partial in situ that it balances those forces.
Brilliant.
So, that's partials in a nutshell.
In a nutshell. Pretty good nutshell too. Yeah. Thank you very much, John, for explaining all of that. Now, if you'd like further information and, of course, to book your appointment for your Duchenne Smile, make sure that you give them a call. Their address, 236 Springfield Road, Christchurch. Phone number 0337544444, and do email Heather as well, heather@duchenne.co.nz.